let's see where she is and go from there.
Yeah, tell me your tricks so maybe
Yeah.
I've used them, maybe I don't know them. Because, yeah, my tricks have been, you know, flipping the wires on top of the brackets, using the triangle
Yeah,
elastics.
I don't like to do, especially a one-tooth piggyback like that.
Because inevitably you're going to reposition the bracket, or you're going to lift up the
Well,
wrong teeth.
you tend to lift up the wrong teeth. The problem you run into is because the
Or you're going to extrude too much.
the action is, the wire cut's so sharp coming over that bracket, the adjacent teeth particularly, just like with the high canine, right?
Yeah, you get a bowing effect.
Yeah, exactly. And you'll tip the teeth too, because
Yeah.
the wire being locked in the slot comes straight up, so the tooth adjacent will turn towards the higher spot. It's almost like you have an artificially high canine in a way.
So let's see where we're at today. Oh, see, we're pretty good now.
That's pretty good.
Yeah, we were completely out of bite here.
Okay, well, that's
you know,
not bad.
that's pretty good today.
Yeah, right on the other side.
Yeah, see, we're almost, oh
Good.
my goodness.
Okay.
So we've got nothing. Yeah,
Good.
she's still, now, in your smile today, you still don't like this cuspid here. You think it's too low. I think we just need to do some enameloplasty. Open a little bit in there. Yeah, see, this is too low. I think it's got
Yeah,
a jagged
that's
edge.
relative to this one. This one's just pointier than that one, so I think if we polish that one,
Yeah.
it'd look very, very
I'm
good.
going to start by doing that in a minute. I'm going to show you in the mirror, and we're going to see what it looks
Yeah.
like. But what are the other tricks you were yeah?
And for this one?
Yes, you were thinking, I think you're right as well. Something's funny about the lateral. Could it be that the angle of the root is wrong? Do we need to distalize?
Something like that.
Yes. Go ahead and open for me, please.
Do you think we need to, would it increase the stability, long-term stability of the treatment if we distalize the roots of the laterals?
It's probably a root issue now. What we'll often do in this situation, if we're not 100% sure, what I'll say is take a Panorex.
And see
Because you can
the
really
angulation?
obviously see the angulation.
Okay.
It appears to me though that, yeah, if you look at the bracket, it looks like it's likely rotated, okay, and it needs to come, looks like it'll probably have to come counterclockwise to
Yeah.
give a little distal
Yeah.
root tip there.
I can see it very well now that
to
you're
do
saying it.
that. Yeah, you can kind of, you know, you can feel it, but oftentimes, you know, for
So
a
the
lot of...
bracket is like this right now.
Exactly.
And I need to put it like this.
So remember I was talking about when you're placing the brackets, how the incisal edge and the bracket slot to be parallel? This is a perfect example of that. Now this tooth is chipped a little bit, but you see how the bracket is rotated
You see that
relative
on
to, if you visualize where it would be if it was unworn. So what happens is the root tips inappropriately. So
The
that's
bracket's
exactly.
like this, we need to do it like this.
Exactly.
This is what we need to do.
So it's not parallel to the incisal
So
edge.
we could do a new bracket today, Steph, and you could reposition it, do your bracket gauge, get it at the same height. The height's right, it's just the angle is wrong.
Now, in particular, when we're rotating, well, I don't think we have to do upside down because it wasn't very palatal originally. It's
No.
not a torque issue. It's a tip issue. I do like to. This is where I do like to put the pencil marks, though. So you mark where it is, you know, and then so when you put it on, it's just an extra way to check that it is actually tilted. Because if it was put on that way once, there's often an illusion that makes you want to put it on that way. So just to make sure that it's actually
So where would you mark?
center. So I would actually, I just put the mark. Actually, give me a pencil.
I don't know how long you want your lead. Or is that too long?
It's just right. I'm trying to mark where it is. Okay, now. So I know where the bracket was. So that way when you put it on, you know, you're actually between that spot, of course, so some of it will come off, but you'll be able to see that it has to rotate that way. So it just gives you another visual cue besides just looking at the center. Don't forget to look, you know, so when you put it on, check your centering this way, check your centering from the occlusal, and then come back and look, where is my incisal edge and my brackets left to make sure that they are parallel. So go ahead and open for me. So right now, see your here, okay, see how you kind of tip like that? So it'll be more like that. Okay.
And as for the height, you're already at a good height, so you want the alignment, the wire to pass at the same height with all the other brackets, so.
You can, before you take it off, just measure with the height gauge.
With the gauge.
And then just replicate that same
It's supposed to be at 4.
exact number, and it'll be in really good shape.
Oh, sorry!
When you do with the gauge, like, it's for the way how you,
Right.
you know what I mean? This
Yeah,
way.
you want to make sure that the fat part of the gauge is basically perpendicular to the tooth so that you're not like this or this. So get that flat on there perpendicular to that, and that's how you do it. Now when you do it on the posterior teeth, you don't have an incisal edge, right? You have a cusp tip. So you have to imagine what would a plane going across that cusp tip be, okay? And then it's just kind of the occlusal plane, you know, of the desired occlusal plane, so you're not like this or like that, okay? So here it looks like we're pretty much right like so. So it looks like, yeah, we're right around 4 millimeters there, okay? Now, you see it because we have some chipping and wear, and you know, where it's kind of rounded off here. The good thing about that is if you have that situation, when you're metering using your height gauge, you can move this as needed. See how nice and fat that is? Okay? So what that means is even if you have a chip, as long as you have that touching, even if you have to come like way over here, if the case warrants it, or over here, as long as that's on there, you're in good shape. So yeah, I would just rotate that. I think you're going to be in very nice shape. Now other tricks you can do, one thing you can do is instead of using your 20-20 tie, you can go to a braided wire.
I've got those.
Okay, so what you do is you determine which arch do you want to move. Okay, if it's more lower coming up,
Yeah.
or upper coming down. If it's lower, let's say it's lower coming up.
It wasn't her case, yeah.
Okay, then you would put the braided wire on the lower
Yeah.
with your elastics, and that will help bring those up higher. Okay. In a severe case where it's really not wanting to close, another thing you can actually do is cut the wires distal to the canines. So no wires, and still do the elastics. And it'll settle. She's in pretty good shape now from what she did last time, so I would maybe, I would just do it to do it too. It's good now, I think it'll be okay.
So-
if you put a lower, like a 21, 25 braided,
Braided on the bottom.
ideally on the bottom, keep what you have on the top and still run your elastics, and that way it'll seat the rest of the way.
Perfect.
Lower coming up. The upper kind of, because it's going to be stronger than the braided, the lowers are going to seat into the
Okay.
uppers really
They're in the
nicely.
JC
21
packages.
by 25 braided on the bottom?
Yeah, they're in GIC individual packages, I
Did we
believe.
say through the 3 or the whole way back? Sorry, did you
For
say
what?
we're cutting the wire? Or
No, we're gonna
No,
leave it.
do the whole arch.
Okay.
Yeah.
Yeah.
Turn it open really big for me. Turn here for me.
And the only other fine-tuning thing I see is you may want to rotate this incisor a little,
Yeah.
so it's rotated easily, it looks like.
Yeah.
So a distal rotation, so I would just go from the mesial of the, that would be what, the 33?
It's 31 mesial to 33 mesial.
Correct.
To PC.
Yeah, and then everything else is perfect. Good, yeah, that'd be great.
So you can do the bottom and then put the new bracket on the top and come and get me once it's in position, and I'll just double check the position.
And you're going to polish the edge of the 23?
Yeah, you can,
I
yeah,
have it set up.
yeah.